All right, so today we are going to talk about urinary tract infections. These are a bacterial infection of the urinary system. All right, so what is a UTI? This is a bacterial infection. It is typically caused by E. coli. Other bacteriums can cause it, but it is typically an E. coli strain anywhere in the urinary tract. Now, we have an upper and we have a lower urinary system. Okay, so upper, we're looking at the kidneys, upper part of the ureters. Then the ureters take us down to the lower urinary system, which include the bladder and the urethra. When we have a lower infection, we are looking at an infection of the bladder and the urethra. These symptoms are frequent urination, bladder pressure, burning with urination. What can happen if we don't address a lower infection is that the E. coli or other bacterium is able to travel up the ureter into the kidneys. Once it's in the kidneys, this is known as an upper infection. This is more serious, can cause nausea, fever, flank pain, which is pain from the kidneys that you feel in the back, kind of under your ribs. Um, it can cause blood in the urine, and if not treated, kidney scarring as well as sepsis. This is a big one here when we see elderly patients in the ER for UTIs. This is a major concern. We are going to get into a little bit of anatomy here and talking about some of our at-risk populations and kind of why they're a little more at risk for UTIs. First off, as we mentioned, anyone over the age of 65, this can be due to lower immunity. As well as some of our population over 65 use catheters. This is obviously introducing external bacteria into your urinary tract can increase your chances of UTI. Something that is kind of interesting is that women are actually more predisposed to UTIs due to our shorter length of urethra as opposed to men. Now, men can still get it because those who are sexually active are able to get UTIs. Again, outside bacteria is being introduced into your urinary environment. So it can still happen to men, but they have a much longer urethra before the bacteria travels up to the bladder. Those who fail to fully empty the bladder or fail to drink enough water, drinking enough water is what flushes out our urinary system. And when you don't fully empty your bladder often, it leads to a nice little environment for those bacteriums to grow. And something that's actually quite interesting that we'll talk a little bit later when we look at our homeostasis values that can cause UTIs is that perimenopausal and menopausal women can be predisposed to these due to pH changes from our lack of estrogen during these times. So we'll get a little more into that in a second. Speaking about pH here, this is our first kind of homeostatic variable that can affect UTIs. Ideal urine pH is 6. That's kind of the middle number. It can range from a 4.5 to like a lower 7 range here. So, slightly acidic to slightly basic. However, once it gets more towards the basic and alkaline, it can actually allow environment for bacteria to grow. They don't love to grow here in this acidic environment, which we'll actually talk about later in regards to prevention. Um, and yeah, this is kind of a note to what we had mentioned in the previous slide, but women going through menopause, or even if you're on certain birth control methods that affect your hormones, that can add a disruption in the vaginal pH, which therefore leads to changes in your microbiome. The vagina has a vast microbiome. It's all very close to our urinary system. So large changes in that environment can lead you to be more predisposed to UTIs. Lucky us. And then here we have our other homeostatic value, which is a lack of a microbiome. Unlike the environment of our vagina or small intestine, these two organs have such a vast microbiome. Our urinary tract is the opposite, and it is a near sterile environment. So that means when we have a foreign bacterium introduced, it is a lot easier to get an infection because we don't have a vast little army of microbes to try and fight it off. So yeah, that's why UTIs can be so common as well. And this is a little note here. We'll talk about it in the next slide, but urinalysis tests will help to determine if there's an infection. But like we said, typically it's E. coli, but sometimes it's not. So it won't show what bacteria strain is present. So that's why we always want to send it to a lab for a culture to know what kind of antibiotics we need to take for whatever form of bacterium is causing this. And here we are going to get into treatment. Okay, so active UTIs, you have to take antibiotic treatment for them. It stinks, but that is the only way to get rid of the bacteria. Antifungals and vaccines won't work because it's not a fungus, it's not a virus, it's bacteria. There are some people who experience recurrent UTIs. A lot of them are in our at-risk populations here, elderly, people going through hormonal changes, women, sexually active people can experience those recurrent UTIs, which we'll talk about prevention here in the next slide a little bit. This is also why it's so important to finish your antibiotics, even if you're feeling better. And then again, this is why it's so important to see a provider, number one, for your analysis to make sure that it is a UTI and not something else. The nitrates and the leukocytes on the dipstick will tell your provider that there is some kind of infection in your urinary system because those are signs of white blood cells. But that's not going to tell them what bacteria is causing your treatment. So you need to get a culture so that the lab can have it grow and see what bacteria was present. And here is where we're going to get into one of my favorite topics ever, which is prevention. And this is the question I am going to leave here for us, which is why are people who are suffering not given proper options for prevention? We're quite quick to throw antibiotic at things, but shouldn't we be more focused on prevention over treatment? And this is Hiprex, okay? It is a prescription medication. It is not an antibiotic. It works as a urinary antiseptic, okay? How it works is once it gets introduced to the urinary system, it produces formaldehyde in our urine, so mostly in the bladder while it's sitting there. This allows for the killing of pathogens and bacteriums that are not supposed to be there in case you get recurrent UTIs. That means your urinary system might be predisposed to this. You might have a biofilm, and this will help get rid of that. It makes the pH very acidic so that nothing can live in there. The thing about Hiprex, though, is that you need to already have a slightly acidic pH for it to be able to produce the formaldehyde. This is why some people take vitamin C as well with Hiprex to try to increase the acidity, decrease the pH. And again, the Hiprex supports the homeostasis, if you will, the sterile environment of the urinary tract. They don't want a bunch of microbes up in there. The urinary tract wants to be clean. And the amazing thing about Hiprex is you can take it for prevention to try and avoid the antibiotics because antibiotics do make bacteria antibiotic resistant. After you take them X amount of times, they can ruin your gut microbiome as well as bring things like yeast infections. Not a fun time. But again, you have to take the antibiotics when you have an active infection. So whereas we're waiting for people to get an infection to continuously treat with antibiotics, we could be using methods such as Hiprex to work on prevention, which is super cool here. I actually had to do my own research and tell my doctor to give me this because I was tired of taking antibiotics too. So it was super cool to learn exactly how it works. I had no idea it produced formaldehyde, and that's how it helped me out. And here are our references. Okay, so remembering that our question is why are we not focused on prevention for these infections? We have our Mayo Clinic staff that helped us with all of our awesome basic information about UTIs, a review from NCBI. As to how the vaginal microbiome can affect uh, chances of getting UTIs. We have our Mayo Clinic staff about the urinalysis dipstick cultures, and then as well as another NCBI article and journal about the hip Brex and how it has helped people prevent UTIs. Thank you so much, and I hope you enjoyed this presentation. Bye.